Good afternoon. My name is Dr. Lloyd, and I'll be performing your inguinal hernia surgery if and when you decide to go through with it. Now, I scheduled this appointment today with you to go over a few things, before, during, and after surgery. There's a lot of important things that I'd like to go over with you, so you're not going into this surgery blind. I also want to check some of your vitals, make sure that you're, fit for surgery. Surgery tends to have a real huge effect with stress on the body. So we like to make sure that you're in top shape before surgery, or at least, in surgical condition. Yeah, exactly. I'm really sorry that we have to meet like this. I've actually performed this surgery over a dozen times. No. We'll go over that. We'll go over anesthesia, stuff like that. But I promise you, it's completely painless. The mesh that we stick in can cause, and again, we'll go over that in a minute, but it can cause some discomfort, some pain, irritation, but, it beats it beats having, your intestines popping out of your muscle wall. That's exactly what it does, yes. Alright, well, I'm going to go over your charts here for a minute or two, just so I can catch up on what the nurse that was in here before me did, and some of your past issues. Okay? Okay. Address and phone number are still the same? Okay. Let's see. Family history. Your family history has high blood pressure, diabetes, asthma. Okay, and that's on your mother and your grandparents have here. All right. Okay, so we can mark hernia down on the list. Inguinal. ever smoke? Okay, excellent. That's good. Okay, consultation for inguinal hernia surgery. And today's date of consultation. Okay. Okay, so the nurse took your height and weight. All right. I'm going to have to schedule you for a blood test. Okay. So what you'll do is you'll go, well, it's actually the building right next to the hospital here. Alright, and they take your blood, do all the testing right there. Well, you should hear about the results in, I'd say, about a week, if that. They're pretty quick over there. Oh, really? You've had a blood test take like a month? Wow, that's something. Well, we aren't going to wait a month. Okay. Okay. Now, let me get this filled out. Inguinal hernia. Months of September. Date 9/2/24. Okay. That's good. Oh, I'm just getting your surgery report ready. There's a lot of paperwork. September. Medical unit. Lloyd'S. General Hospital. Today's date is 9/2/24. Right. Excellent. Okay. Now what I'm going to do is I'm just gonna, give you a quick little physical. That's all it is. Just a quick little physical. Blood pressure, listen to your heart rate, check your eyes, your mouth inside, feel around. Yeah, things like that. Alright? Today's a fairly easy day. Nothing to worry about or get stressed out about. Okay? Alright. Okay, so let me put on some gloves. proceed with the physical exam. And then I'm going to teach you all about the hernia. And check your x-rays as well. You just stick your left arm out like that for me. Okay? Wonderful. Let me know if it's too tight. Okay, it's good. Beg your pardon? Do you get a lollipop after this? I may or may not have lollipops in my cabinet. I will not confirm nor deny. Let's just slip that in there. All right. Very good. Okay, let's take this off. Very good. Blood pressure seems to be fine. Going to do breathing exercises. I'm going to listen to your heart and your lungs at the same time. Now, what I'm going to do, all right, is I'm going to tell you to breathe in a real deep breath, a real deep, refreshing breath. I'm going to have you hold it. And then I'll tell you to exhale. And we'll continue this little process maybe 5, 6 times. All right? Okay. Okay, if you lift up your shirt just a little bit. Perfect. Okay, this might be cold. I'll let you blow on it. There you go. Okay, ready? And breathe in. Nice deep breath. Hold. And exhale. Again, breathe through your nose. Deep breath. Hold. And through your mouth, exhale. Just like that. Let's go over here. Breathe in. Hold. And exhale. Breathe in. Hold. And exhale. And now over here. Breathe in. Hold. And exhale. It's quite calming, isn't it? It's a 2-in-1 deal. Breathe in. Hold. And exhale. Great. Oh, you're doing wonderful. Okay, so lungs are fine. Okay. Now I want to check your eyes, your mouth, such and so forth. Okay. So I have this tiny little light right here. It's not too bright. I'm going to shine it into your eyes. Okay. And into your mouth, of course. Then I'm also going to have you follow the light. Alright. Now, I am going to get a little close, okay? If that bothers you, let me know. Okay. Do what I have to do, okay? Alright, keep your eyes open wide, like so. Good. we didn't really talk about this. How did you exactly suffer this injury? I see. Oh, so you worked down at a Lloyd's grocery store. Yeah. You were unloading the truck. I see. Well, you know, and in a scenario like that, a lot of bad things can happen. You know, you got heavy machinery, you got, you know, heavy shipments coming in, you know, all kinds of, you know, danger. Ow. Nah, that must not have felt very good. Yeah, that makes my groin hurt. Ow. Okay, wow. Okay, let me check your mouth. Open up wide, like so, just like that. Keep going, Okay, looks good. Okay, while keeping your head perfectly straight and stare right here. Okay, keep your head perfectly straight. I want to only see your eyes move. Okay, follow the light with your eyes only. You'd be surprised. I've had a lot of people, they're like, So, okay, right here. Perfect. Okay. Alright, so your eyes, left, right. Okay. We passed that test. Is your hernia out right now? It is. Okay. If I could get you to stand up for me, please. I'd like to just, you know, feel around, see what we're dealing with here. All right. Okay. So I'm just going to press around the area. Get a feel of it. If you feel any discomfort, pain, anything at all, let me know, okay? Alright. I promise I'll be gentle. there it is. Looks like it busted about 2 inches, maybe 3 inches of abdominal wall. Now, do you, when it pops out, do you massage it back in? Do you wear a hernia belt? Anything like that? Oh, okay. You got a hernia belt. All right. Yeah, all right. Okay. And how's that working for you? Keeps it in? Okay, good. Oh, there it goes. Goes back in. Okay, well, you can have a seat now. I just jot this down. About 2 inches diameter, muscle, abdominal muscle wall, torn. You say you wear a hernia belt, right? Okay. He does wear hernia belt. Alright. Okay. Okay, so I wanted to explain a few things here. I have a packet of information for you to take with you. Alright? It just basically covers the same stuff that I'm going to talk about right now. Okay, so, as you know, you have an inguinal hernia. Exactly. So, here's what that looks like. I don't know if you know too much about it. You just know that your intestine popped to your muscle wall. Okay. If you take a look at this diagram, you'll see your hernia is right here. Okay. That's the inguinal hernia. Usually in your lower abdomen, your groin area. And as you can see here, here's your muscle wall. Okay. See this piece right here. And this piece right here. And then your skin's right here. This is your intestine. And as you see it, it just bursted right through the muscle wall and now bulges out. Common knowledge, right? Yes. Now, as you may or may not know, there are risks involved in this. You know, one might not think that it's much of anything. You know, you can just blow it off. That's not the case. Take this for instance. Okay, here's your inguinal hernia. This is your scrotum, as well as your groin. This is normal. That's what it looks like when it's normal. Here's what your groin area looks like when your hernia has popped out. Here's the hernia with the intestine. Here's your scrotum. Now, here's what can happen. Your hernia can literally fill your scrotum. And this can be very, very painful. Very painful indeed. Not only can it wrap around and cut off circulation to the testy, but the hernia itself can get pinched and cut off, kind of like a garden hose. Okay? It can cause bowel obstruction. It can cause part of your intestine to get cut off from circulation and actually die off. That's another procedure we'd have to do. We'd have to go in, remove the dead section of the intestine, stitch you back up. Quite a process and a lot of pain. So do you have any questions so far? Okay. Now, have you experienced your hernia going into your scrotum yet? No? Okay. Well, that's why we need to do this procedure. We don't want to get this hernia, we don't want to allow it to get 1,000 steps ahead of us. We want to nip it at the bud. And that's what we're going to do. Now, I have a packet, 2 packets of information here for you. Okay, and here is a packet of information for you. It goes over everything. It goes over information about what is a hernia, treatment options, before, during, and after surgery, risks. It goes over everything. So this is yours to take home with you. You are very welcome. Okay, so I wanted to go over your x-rays. I didn't get a chance to take a look at them. I have them right here. Okay. So yeah, I see it right there. Can you see the hernia? It's right here. All right. There's a better look. Yeah, wow. Yeah. Okay, so prime example. Okay, this here's an x-ray of your abdomen. Now, if I can find my pen. Alright. Now, I want you to take a close look. Alright. Here's your pelvis. Here's your legs. you see this empty space over here, towards over here. See this mass right here? That is your hernia. Yeah, we definitely need to do the surgery. I can already see risk involved here. Was it going into like your scrotum or even tangling? Yeah. So here it is. And right here, that's what I'm worried about. See, as this here pops out of the muscle wall, it's bending like a garden hose. And that's what we need to worry about. See, as it bends, it will cut off circulation to the smaller part. That is bad news, yes. We'd have to cut this section off and then sew this up, reconnect it to the other side. It's a process, and that surgery will probably be more painful and more time to recover than getting the mesh put in place. Here's another x-ray, and as you can see right here, that bulge right there, that's your hernia. Yeah, sure, you can see it up close. See right here, that's your hernia right there. Here is both sides of your groin area. Okay, the right side and the left side. Now, as you can see, and what I'm about to show you happens from time to time. So, on your right side, we have the tear in the muscle wall right here. Now you see the left side? See this little dot right here? It's starting to push through the other side. So we're going to have to patch both of these up. You'll be getting two mesh, yes. Because you don't want it coming out of that side and this side. That's going to be a tangled mess. And cause some real problems. That's when bowel obstructions happen, blockage, it can get really bad, really quick. Yeah. Right here. It's your hernia popping out right there. As you can see, it's right there. Here's your scrotum, and there's your hernia. It's getting real close. Alright, well, what we're going to do with the mesh and repairing the hernia. So here's a diagram of the procedure. But I don't know if you want to see this or not. Okay, I was just wondering, didn't know if it was gonna, maybe stress you out, but or freak you out, for that matter. But we'll make an incision, okay, where the hernia is at. Then we will stuff the hernia back in, place a mesh. See the mesh? Looks just like a little gauze type thing. We place the mesh, keeping the hernia inside, and then we stitch you back up. Yes, actually we do. We stitch the mesh to the muscle wall. That way it keeps it in place. Yeah, we don't just stick the mesh in and think that's where it's gonna stay. No, we make sure that it's gonna stay in place and keep the hernia in. Here is a zoomed in version of the procedure. It's really quite simple. Like I said, we put the hernia in, we put this mesh over the busted wall, and then we stitch it to the muscle wall, and it keeps it nice, safe, and secure. Now, do you have any questions so far? Okay, so let me see here. Okay, so I'm going to go over some information with you, about the surgery, and what to expect, okay? Now, with all procedures, all surgical procedures, there's always a risk of things, all right? Doesn't necessarily mean that that's exactly what's going to happen to you. It's just, there's a risk for it. Long-term pain, recurrence, urinary retention, seroma, injury to internal organs, infection, hematoma, testicular pain or swelling, nerve pain, heart, breathing issues, and of course, death. But, as of now, there are no reported deaths of a hernia surgery. So, but it's still on the list, because there's always that chance of things, I don't want to, make you any more nervous or anxious than you already are. I just, you need to know this. Now, preparing for your operation. Okay, home medications, bring a list of all the medications and vitamins that you're taking. Most often you will take your morning medications with a sip of water. Anyhow, so home preparation. You may go home the same day of your procedure. If you have nausea, vomiting, are unable to pass urine, or if the hernia was incarcerated, you may stay longer. Anesthesia. So you'll be talking the day that you come in for your surgery. You'll be talking to the anesthesiast. We're probably going to put you under general anesthesia. You're in good health. I just checked you over. We'll check you over again before surgery. If there's anything that might, be of question, then we'll do a local anesthesia. Okay? But like I said, you can discuss this with the anesthesiologist when you see them. The day of your operation, do not eat or drink anything. What to bring, your insurance card, identification, advance directive, list of medications, loose fitting clothes, slip-on shoes, and leave jewelry, valuables, things like that. Leave them at home. Let's see, during your operation, preventing pneumonia and blood clots, preventing infection. The packet I gave you is just like the one I have here. Like I said, it goes over everything. Let's see here. And there is a lot of information to go over. But I'm just going to summarize it here. Like I said, you can, on your own time, at home, go over everything. There's a lot of things to read. Your recovery and discharge. Nutrition. When you wake up from the anesthesia, you will be able to drink small amounts of liquid. If you do not feel sick, you can actually begin eating regular food. But I'm pretty sure you're going to be a little bit nauseous. So I'd stick to just drinking stuff. And, maybe a light snack like Jello or something like that. Activity. Slowly increase your activity. Full activity may usually be resumed in 1 to 2 weeks for laparoscopic and 2 to 3 weeks for open procedures. And that's what we're doing on you, is the open procedure. So, you can, in about 2 to 3 weeks recovery time, you'll be able to slowly increase your activity. Sexual activity, about 14 days, about 2 weeks or more. Do not strain or lift objects over 10 pounds or participate in strenuous activity for at least 2 weeks. Work. The average time to return to work is 14 to 21 days. Wound care. Always wash your hands before and after touching near your incision site. You don't want to risk infection at all. It's not a good thing. No, not fun at all. I agree. Yeah. Do not soak in a bathtub until your stitches, steri strips, or staples are removed. You may take a shower after the second day, unless you're told not to. And then, of course, follow your surgeon's instructions on when to change your bandages. Let's see here. Now, when changing the bandage, there may be drainage. Okay? It is disgusting, but it's something you have to do. You're going to have to keep this wound extra clean. Okay? Now, if the dressing is soaked with blood, call me, because that's a serious issue. If you have steri strips in place, they will fall off in about 7 to 10 days. We're not going to be doing that. If you have a glue-like covering over the incision, allow the glue to flake off on its own. You know, no scrubbing or rubbing or picking or anything like that. Just let it do its own thing. Avoid wearing tight or rough clothing. It may rub your incision and make it harder for them to heal. Protect the new skin, especially from the sun. The sun can burn and cause darker scarring. Your scar will heal in about 4 to 6 weeks and will become softer and continue to fade over the next year. Bowel movements. Avoid straining with bowel movements by increasing the fiber in your diet. With high fiber foods or over-the-counter fiber medications such as Metamucil, you don't want to, be pushing a big one out. That'll strain your hernia, and it'll just pop right back out, or pop out the other side, for that matter. The amount of pain, right? Pain. The amount of pain is different for each person. For adults, the average time narcotics were used was 3 days with some patients, needing no additional pain medication. You can use throat lozenges if you have pain from the tube placed in your throat during your anesthesia. But other than that, it's really a person-to-person thing. Each person is different with pain tolerance and the amount of pain they get. Do you have any questions? Okay. No, no driving for at least 2 to 3 weeks. Do you have somebody that you can, call to be a taxi service? You have a couple friends, a couple family members that can? Okay, good. Let's see here. I think we covered just about everything. So, no questions at all. Alright. Okay, so what I'm going to do is I'm going to order you your blood tests that I was talking about. Get them rolling. You said that your hernia gets quite painful at times, like debilitating. Okay. I'll write you a prescription for some pain medication for when this happens. Alright. And I'll continue it, past your surgery as well. I'll also be giving you a call within the next week or two regarding scheduling your surgery. Okay. All right. Well, I definitely feel for you. You know, going through this on a daily basis, it's got to be hard, especially working, doing the job that you're doing. I could imagine. I could imagine it does get quite painful. Are you even, you even passed out from the pain? Gee. Well, we're going to get you all fixed up. Alright. Okay. Well, let me take my gloves off and then I'll shake your hand and let you go enjoy the rest of your day. Well, you enjoy the rest of your day, and I will call you to schedule your surgery. Oh no, I haven't been outside since this morning, since I got here at work. I have a lunch break coming up in about a half hour. I'll get to soak up some sun then. But at least you get to. Alright. Well, you take care. And keep the hernia belt on. Decrease the, the amount of hard work or straining that you have to do. Keep it to a minimum.